professional life, with your families and with your communities. I'd also like to thank the organisers for inviting me to speak today, which I suspect is largely due to the work of Gordon. And I just want to take a second here to acknowledge him. He's been quite a supporter of Aboriginal organisations over his long career, and I think I can speak for all of us and say he will be missed.
Yes.
And I'm really sorry I'm very proud of him. So I've been asked to share my thoughts on how to improve the health and well-being of Aboriginal and Torres Strait Islander children in remote and regional Australia. heaps of great work. And one of the features that I've been hearing about this on this conference so far, Kerry just put it in a nutshell, we need to do things differently. People have talked about changing things, doing it better, but I think doing it differently, because really with the stats that we have in Aboriginal health and other areas, it hasn't worked. It just hasn't worked, despite all of our efforts. So there needs to be something bigger happening here, which I'm going to sort of try to address today. We need local action, local at community level, which we've already been hearing about this morning, and the program that Emily and June run in Fitzroy Crossing. At the last round of IAS funding, that fantastic program, which the whole nation knows about, its funding was cut. They had to make up for $1 million, which was lost to the program, so they could still continue to run their services with their families. The corporate sector had to reduce their working days so they could still run their programs. So they're spending a lot of time at the moment trying to get some of that money back to continue running that program. So it doesn't make any difference how good you are. If you're an Aboriginal organisation working with Aboriginal people, you have to completely, all the time, justify your existence, and we're getting a bit sick of it. So we need appropriately designed research to inform service delivery and policy making, as Kerry has been talking about. We need integrated, high quality, comprehensive primary health care, delivered under Aboriginal community control, as delivered by Congress, as John just made that fantastic presentation. But today, I want to add a couple of further things Australia needs to consider if we are to see our children, all of our children, grow up happy and healthy as accepted and valued members of the Australian community. The first is a consistent policy and program approach to health and well-being, one which is based on the evidence of what we know works, but which is flexible enough to take account of local knowledge. We all know blackfellas can't be trusted with money. Money needs to be delivered so that local programs like the one that June and Emily and Congress run, so they can manage that money and deliver the program in the way that they see best, rather than constantly having to justify their existence, as I say. The second is a need for a process of genuine reconciliation between Aboriginal and non-Aboriginal Australia to reset the foundations of what has been a profoundly damaged and damaging relationship between Australia's First Nations and those who have come after. In speaking today, my focus will be on the needs of Aboriginal and Torres Strait Islander children living in rural and remote areas. All children, however, wherever they live, whatever their racial or cultural background, have a right to good health, to a proper education, to a nurturing and safe home, and to a supportive community environment. We know that families living in rural and remote areas have worse health than those in Australian cities. Their health and well-being needs and their needs for future access to quality health services needs to be addressed as well. In this context, I should mention the importance of Aboriginal medical services for the health of all people in rural and remote areas. AMSs, although they're funded to provide primary health care to their communities, they also see anybody who turns up at their clinics as well. And often they're the only medical service for anyone in the market-driven, GP-led model. Frequently breaks down once you get away from the cities and away from the coast. You know, a lot of mature age Australians, you know, going on their trip around Australia, they'll turn up at the clinic at Broome or Mount Isa because they've forgotten their medication or something's happened to them. So I was in Broome once, and in the car park there were several of those vans, and people who were elderly Australians were sitting in the clinic along with the local community, hoping to see a doctor or to get a script written. So these are extremely generous provisions that our AMSs make to all kinds of people. So while their focus remains on their own community, and although they are not funded to do so, some AMSs provide these services, and I think this is an example of true empowered reconciliation in action. This matter aside, the evidence tells us that the needs of Aboriginal children in remote Australia are particularly acute. You all know the health statistics, and I don't intend to repeat them here. There's been some great material presented this morning and over the last few days. But those statistics about low birth weight, higher rates of childhood disease and higher rates of hospitalisation are just the tip of the iceberg. They are driven by deeper social determinants of health, and if we are going to turn around the health statistics, we need to address these deeper drivers of ill health. For example, in education, a key determinant of health over the lifespan, school attendance rates for all Australians are highest in the cities and lowest in the very remote areas. And the gap in attendance between our children and their non-Aboriginal classmates widens as remoteness increases. And I also know that story about Wadeye, when they had people going around and making kids the truancy officers. If all the kids in Wadeye actually turned up to school, there wouldn't be chairs and tables anywhere for them to sit, because the NT Education Department was basing the resources to these schools on how many kids turned up. Although they knew there'd probably be 20, 25 kids in that class and they were the right age, only 8, 10 regularly turned up, so we'll just have 15 chairs and desks. So even if they were highly successful, there was no room for these kids to sit and learn in the classrooms. Aboriginal people living in remote or very remote areas are much more likely to be living in real grinding poverty. And again, housing. Over half of Aboriginal households in remote or very remote Australia are overcrowded, and a high proportion of those houses do not have working facilities for maintaining health. And there are other less easily measurable factors behind the poor health statistics: discrimination and racism and exclusion from the life of the nation. All of these issues begin acting on life of Aboriginal and Torres Strait Islander children before they are born, and powerfully shape their health and well-being throughout their lives. But you all know this. The cultural determinants of health, that is, connections to culture and country, go some way to protect our kids and young people as they grow up, giving them a sense of self and belonging and spirituality, which can offset sometimes some of the other social determinants of health. But overall, the picture is a hard one, and addressing it is complex. And of course, nothing is easy. It means putting programs in place, adapting them with local Aboriginal input and control, building the trust and relationships that are at the heart of success, and learning the lessons of what is working and what needs to change. This is why the first key things we need if we are serious about improving the health and well-being of our children in country Australia is consistent, evidence-based policy. But what we don't need is, unfortunately, what we have had for the last 10 years. The last 10 years have been horrific for us. And as Kerry said, we haven't collaborated on our presentations. But you know, we are really on our knees here. We are on our knees and we are sick of it. Beginning with the intervention of 2007, we have seen the rolling out of waves of policies and programs which has seemed to be driven as much by ideology and wishful thinking as evidence. They certainly haven't been driven by Aboriginal and Torres Strait Islander peoples and our communities. The intervention itself included numerous provisions for which there is little or no evidence, and not surprisingly, little support on the ground. For example, compulsory acquisition of townships, this is part of the intervention, punitive welfare changes, and compulsory health checks. In addition to the lack of an evidence base, there has been constant frenetic change. Successive governments have continually modified and updated the intervention with major changes in 2008, 2012 and 2014. Then there has been the National Close the Gap programs, which provided some welcome further investment, but with their own goals and targets, and in fact the gap is indeed widening. And finally, we have suffered under the Indigenous Advancement Strategy, the 6 major changes in Indigenous affairs in 15 years, where they can just go and they just cut programs willy-nilly. It didn't matter whether it was successful or not. So long as you were Aboriginal controlled, managed and run, you were vulnerable. This provided misguided attempt to centralise federal government funding process for all things Aboriginal here in the Territory led to the NT government receiving a quarter of available funding. We have constant change and an atmosphere of busyness and frantic activity. It appears that everyone is expected to get things done before the next wave of policy and program changes rolls over the horizon like a tsunami. Lots of energy is expended, but little is achieved. It's like government is running really, really fast. Their arms are pumping, their legs are going, but they're running on the spot. They're just not getting anywhere. On top of this, there is a profound distrust of Aboriginal people, of our communities and organisations, and of our knowledge and achievements. In fact, sometimes I think that Australia thinks it's somehow or other Aboriginal people that we're trying to trick you. That, you know, it's okay for other cultures in the world, for the Māori to come here and do the haka, the matches and what have you, and you don't have any quarrel with that. But when we stand up and say, hey, we've been here for over 60,000 years, we kind of look over our heads. In fact, the only things that seems to be constant through all these continual changes is an underlying belief that self-determination is a failed policy, that in fact we can't be trusted. That we Aboriginal people are to blame for the situation in which we find ourselves. That we do not have anything to offer, that we are at best risks to be managed. We have to deal with a government-driven policy world where the evidence is ignored if it's not in line with someone's latest bright idea, where constant busyness and change is a substitute for real progress, and where we, the Aboriginal community, are not recognised as experts in our own lives. Through all of this, Aboriginal organisations and communities have done what we have always done. We have endured, we have adapted, we have done our best to protect ourselves from the worst of the decisions and to take advantage of what is available where we can. This situation has, however, undermined the kind of long-term, evidence-based, thoughtful, flexible approach that we need if we are to deal with the challenges of health and well-being in our communities. And we are now beginning to see the results, or rather the lack of results, from this decade in particular of missed opportunities. Every year we go to Canberra to listen to the annual Close the Gap report by the current Prime Minister, and we've had a lot lately, and every year we are told that unfortunately not a lot has changed. The former Prime Minister Tony Abbott in the 2015 report on Closing the Gap said that progress had been profoundly disappointing. The latest Close the Gap figures released by the current Prime Minister doesn't significantly change this picture. And the former head of the Department of the Prime Minister and Cabinet has been quoted as saying that the effect on the Aboriginal reforms of recent years, quote, has probably been to increase the sense of dependence in the Indigenous community, whereas we actually have wanted to try to build their capacity to manage themselves. It sounds like something out in the 1930s in those reports and things that people used to say on, the natives. There. An independent evaluation of the intervention and close the gap measures have given them 5 out of 10 for education, a bare pass despite all the words of policy and money, 4 out of 10 for health, and 2 out of 10 for supporting self-determination. A pretty grim report card. These failures have direct impacts on the health and well-being of Aboriginal people, including children, especially in regional and remote communities. For all this though, I don't think a lot of this is driven by any malevolence. Sadly, these decision makers think they are operating from a place of goodwill. Unfortunately, but they know what's best for us. That is the basis on which they make their decisions. We are somehow or other simple children who need to be protected and looked after. So poor decisions are being made again and again. Poor decisions that are driven by a set of assumptions that are frequently unspoken. We, Australia, can't afford to continue down this path. We need a policy and program approach to Aboriginal health which is consistent, evidence-based, and which ensures Aboriginal input and control. We can't keep going back to the beginning every time there is a new government or a new minister. Every time there are changes, we have to all troop back. Programs, organisations, groups, we all have to troop to Canberra and try to convince the latest Prime Minister or the various ministers that we're here and that we have to justify over and over and over and over again our very existence. So every time there's a change like that, for us, we go back to ground zero as if nothing has happened. We just can't keep going back to the beginning all the time. This brings me to the second thing we need to improve: the health and well-being of our children. At the political level, we have a multi-party commitment to closing the gap. But that commitment needs to be more than a bland assurance every year that there has been some minor improvements. We need to put this issue at the centre of the life of the nation state. We need a foundation document that is mature enough and sophisticated enough to set out a set of principles that can guide policy, not just for the life of a particular government, but over the long time. Currently, we have an opportunity to do this through a process of substantively amending the current Australian Constitution. Strong, popularly understood and accepted amendments of this kind would be a key foundation for the kind of policy stability we need. It would establish our enduring relationship between us and our representatives, enduring over the party politics of the day. If you look overseas, the First Nations peoples of Canada or New Zealand or the United States even, treaties have been signed with central governments. Generally, their health and well-being is better. Such treaties have enabled the establishment of direct and stable relationships between First Nations and governments. And this has been a key driver for more consistently effective policy, better services and ultimately better health and well-being. They have issues too, but they don't have to keep justifying their existence. It's accepted. These Indigenous peoples, through these treaties, and there's some criticism of that as I say, but at least they're being acknowledged by their countries as such. They're being acknowledged that they are the first peoples of that land. That's still to happen here. This is why I believe that constitutional change is important for the health and well-being of Aboriginal and Torres Strait Islander children into the future. We must negotiate a proper settlement and finish this unfinished business between us. It's time. I would argue that substantive amendments to the Constitution, one that does more than just symbolically recognise our existence, would have other profound effects on the life and future of our children and young people. It would help to fundamentally reset the relationship between Aboriginal and non-Aboriginal Australia. It would help us as a nation to get over this idea that Aboriginal experiences and ideas don't count, that we are in fact somehow invisible. Because this is what so many of us experience throughout our lives and continue to experience every day. Many of our children, not many, our children grow up not feeling able or welcome to participate in the life of the nation. Outbursts of racism, such as have surrounded Adam Good recently, which seem to flare up every Australia Day, every year, are internalised by many children and young people. You know, in my family, we've made a decision several years ago now. We don't leave the house on Australia Day. It's too dangerous. So we stay inside. Put simply, we don't feel that our unique perspective will be welcome. Our young people in particular hear instead that they are a problem, a burden, and that the dysfunction they see around themselves is all their own fault, or that of their families, the fault of Aboriginal Australia. Poverty and lack of educational opportunities from an under-resourced education system add the effects of unresolved and intergenerational trauma. Well, it's no wonder then that we see the kind of appalling rates of incarceration of young Aboriginal people and Torres Strait Islander people that you see in the Northern Territory and elsewhere. You know, April is the marking of the 25th anniversary of the Royal Commission into Deaths in Custody. There's been a bit of some sort of movement in the media about that. But one of the things that was pointed out that in 2012-13, 9 Aboriginal or Torres Strait Islander people died in prison. The same number as in 1991. And there's been a lot of talk about the incarceration rate, so I won't go on that. But you know, in 25 years, not a lot has happened. There's more Aboriginal and Torres Strait Islander young women now in prison. You know, so wherever you look, there's this depravity that Kerry talked about. Under the barrage of continually changing government initiatives, few of which have any genuine commitment to local management and control, Aboriginal people feel marginalised from the decision-making processes in our own communities, even in our own families. The nation state now, as in the past in the days of native welfare, actually sits at our kitchen table and intervenes in all aspects of our lives. That crucial sense of communal responsibility, the effect on young people of such an environment is of course lifelong. We are losing hope. This has to stop. I'll say to you, that's enough. Stop. We can't withstand this constant onslaught. If we are sick, if Aboriginal and Torres Strait Islander are sick, the nation is sick. The nation is sick. Barack Obama, the President of the United States, described well in his book, Dreams from My Father, and I'll quote, "I know, have seen the desperation and disorder of powerlessness, how it twists the lives of children on the streets of Jakarta or Nairobi or on Chicago's south side, how narrow the path is for them between humiliation and untrammelled fury, how easily they slip into violence and despair. I know that the response of the powerful to this disorder, alternating as it does between a dull complacency and, when the disorder spills out of its prescribed confines, a steady, unthinking application of force, is inadequate to this task." This describes, unfortunately, so well the process we experience in Australia when it comes to Aboriginal and Torres Strait Islander children and young people, and indeed all of us. Addressing that powerlessness and how the nation-state responds to it is truly the biggest challenge we as Australians face. Today we look back on a decade of where there has been a national focus on the needs of Aboriginal kids in remote communities. There have been some improvements in funding and resources, but the reality on the ground has not changed very much, and we can't continue on this path. We have to fix it. And there is a cost to not fixing this that is not just measurable in dollar terms. Our children and young people have inherited the creativity and adaptability that is embedded in our diverse cultures and which comes from tens of thousands of years of living here on this land. We have something powerful and unique to offer the nation. But all of this is at risk. It is at risk of being lost forever if we, our generation, can't fix this for our children, black and white, and the children to come, and settle this business between us. That's our task. I ask you now to inform yourselves about the terms of the referendum, which will give you, as the people of Australia, not just the government of the day, we have the power here to reflect upon what kind of society we are today. What are our values? What are our principles? Australia cannot ignore us any longer and continue to exclude us from the life of our nation. You know, we're not going anywhere because this is our place. Thank you.